In this video, I'm going to talk about ketamine-assisted psychotherapy. What is ketamine? Ketamine is an anesthetic agent that is primarily used by doctors and vets for medical procedures that require sedation. It makes the World Health Organization's, also known as WHO's list of minimum medicine needs for a basic healthcare system. It has been around since the 1970s and is enjoying a popular resurgence outside of hospital wards for its use in treating PTSD, anxiety, and depression, mental health, and ketamine. Ketamine-assisted psychotherapy is proving successful in patients with treatment-resistant depression. This is when more traditional forms of therapy and antidepressant medication have been tried and failed. There is increasing evidence that shows ketamine's efficacy in dealing with OCD and substance use disorders. Patients with any history of psychiatric disorders, such as schizophrenia, should not be given ketamine. Ketamine dosage. Camelback Rated Health and Wellness would consider an individualized dose for each client or patient based upon their mental status, their baseline cardiovascular status, and the results of their physical examination and blood tests. Somewhere between 0.4 milligrams per kilogram and 1 milligram per kilogram is administered intravenously over 40 to 60 minutes. This is called intravenous or IV ketamine. A lower dose is usually recommended for the first dose. Ketamine given via IM or intramuscular is also effective. So IV or IM or troche, those are the different ways, or nasal. Those are the different ways that ketamine is administered. Most clients require 2 to 3 infusions or 2 to 3 doses or 2 to 3 sessions with a 7 to 10 day interval. Maintenance infusions every 3 to 6 months is also a worthwhile consideration. S-ketamine, also known as Spravato, is a nasal spray taken along with an oral antidepressant is also popular, as are tablets that dissolve under the tongue. How will you feel while on ketamine? Clients experience a feeling of euphoria and increased serenity while experiencing the psychedelic effects of a controlled dosage. Intention is important when it comes to getting the most out of a ketamine-assisted psychotherapy session. In preparation for treatment, one should journal and assess what they are hoping to get out of the treatment. The way that a drug works is that it increases neuroplasticity in the brain, allowing you to see old problems through a new lens. To increase ketamine's efficacy, clients are encouraged to abstain from alcohol and to get a good night's sleep the night before. During the session, you might want to listen to a pre-made calming playlist of music on your phone, and you may wish to wear an eye mask and cover yourself with a weighted blanket. Ketamine-assisted psychotherapy circumvents the role of the traditional psychologist, meaning that you don't necessarily need to sit in a discussion for hours unpacking your personal trauma. Rather, it's therapy with yourself. And the effects of ketamine allow you to look at what is going on in your life in your own time. At Camelback, we are on hand to assist the therapeutic setting and in ensuring that you successfully integrate your learnings from the session into your day-to-day life. The advantages of ketamine. Ketamine therapy can ease depressive symptoms within hours. Its fast-acting formula means that you'll know right away whether it's right for you. Gone are the days of waiting 2 weeks for the antidepressant to start taking effect. Ketamine has an extremely high rate of success. Because it stimulates lasting brain changes, this leads to lasting symptom relief. Ketamine therapy calms your mind, reduces pain, and decreases the need for narcotic painkillers. It is especially effective in combating thoughts of suicide and has been known to improve other mental health conditions, including obsessive compulsive disorder, anxiety disorders, and post-traumatic stress disorder. When being administered ketamine at Camelback, you are not at risk of being addicted. You will never be given a prescription, and it will only ever be administered in a small dose at our facility. The side effects of ketamine. The side effects of ketamine are minimal on account of the fact that it doesn't stay in the body for very long, only up to 2 hours after administering it. They are worth mentioning though, and the known side effects can include confusion, the dissociative outer body feeling can prove overwhelming for some people. Other, more physical side effects include drowsiness, dizziness, and nausea. If you have any of the following preconditions, you are advised against ketamine-assisted psychotherapy. This includes high blood pressure, history of heart disease, including strokes and heart attacks, history of schizophrenia and or psychosis, including delusions and hallucinations. Similarly, you can't be under the intoxication of alcohol or any other illicit drugs prior to receiving ketamine therapy. The term being stuck in a K-hole refers to the feeling of being tranquilized or sedated when someone has taken too much ketamine in an uncontrolled environment. This comes from the rave or 90s party scene where ketamine enjoyed popularity as a come-down drug. While under the watchful eyes of Camelback, you are highly unlikely to experience anything of the sort, though this is the kind of side effect one is likely to encounter should one pursue an illicit path of self-administration. At Camelback Integrated Health and Wellness, ketamine-assisted psychotherapy forms part of a balanced, holistic approach to wellness and recovery from substance abuse. Our counselors are skilled in providing a bespoke treatment plan that caters to each individual's client's needs so as to ensure that their current and future well-being is protected and nurtured. We remain committed to assisting all our clients deal with their mental health disorders and symptoms of depression. If you think you could derive therapeutic benefit from a program involving ketamine-assisted psychotherapy, please don't hesitate to contact one of our expert team members to discuss your situation and to find out if ketamine-assisted psychotherapy might be a good fit for you.
If you found this video to be of value, be sure to like it, subscribe to our channel if you want to see more videos, leave a comment if you have a question, if you've got something to say. Camelback Recovery provides treatment services for people struggling with mental health, mental illness, addiction, alcoholism. So if you or someone you know is struggling, be sure to reach out to us. You can go to our website, camelbackrecovery.com, or our information is in the comments section below. And we provide everything from detox, inpatient, outpatient treatment, sober living, recovery coaching, sober companion services. So either we'll be able to help you or we'll be able to refer you to people or treatment centers that might be a better fit. So I will see you in the next video.